I didn't go to college thinking I wanted to become a neurosurgeon. There was nobody in my family who are physicians. So I had 2 weeks experience as a junior medical student. And I thought the operations were fascinating. The neurosurgeon I was working with one day did an operation on a young woman about, I guess she was probably 16 or 17. Took a tumor off of her spinal cord, and she had been becoming fairly rapidly paralyzed. About 3 hours after surgery, we went to see her, and her family was there, and he asked her to move her legs, and she could not move them before surgery. So now she moves her legs. And he says to her parents, "Okay, I think she'll walk." I mean, it was unbelievable, unbelievable that you could have that kind of impact on somebody's life. So that probably was the moment where I said, this is what I want to do.
He was a freshman in college and passed out in class, and no one knew why, and no one knew what happened. And here was this young, vulnerable child. I mean, he was 18, and everyone in the unit just gave him the best care possible, and we kept thinking, we don't know if he's gonna be alive. Every hour it was like, we don't know if we can get him to where he needs to go. And every hour he got a little bit better and a little bit better, and it was a very long haul. His family was the most amazing family. They were so involved in his care, and they took the time to really get to know the nurses, and so it created this relationship, this bond that was just incredible. And he had a lot of really challenging outcomes from this cardiac arrest, and this was 2 years ago, he still comes back to visit us, and he just came back a couple weeks ago, and it was the first time we saw him walking, and his speech was perfect. He was able to hold these great conversations, and every time he comes we all cry because it's the work that we do. And it's the reason that we work, and it's really exciting.
My wife has been an inpatient within Penn Medicine over the years, going back to 1990. She's fine now, she's perfectly healthy, but from the very beginning, I was always so impressed in terms of her treatment and the combination consistently of humanity and science blended together within Penn Medicine. And I used to say to my wife when we came to her appointments that when I retire, I want to work in this place and they can have me for nothing, and that's exactly what I'm doing.
The highlight of my day is when I receive a letter from a patient or a patient's family. And I received a letter like that today from a patient that one of my physicians has been taking care of. And she talked about how Dr. Becerra, after 2 very long surgeries that day, went out to the waiting room and spent time with her family and called her husband, who was at home taking care of the children. He went the extra step to make sure that the family knew that their daughter and their wife was safe and that the surgery had gone well. And to me, it's so wonderful when patients can not only come here for the talented physicians, but that they also realize they're getting the highest quality of care. And it's that compassionate care that our staff provides that really makes a difference for this patient and for her family. And that's what Penn Medicine is all about.
My father was a Penn employee for 23 years, and he was a plumber. He took extreme pride in his work and working for Penn. My dad suddenly passed away while at work, September of 2004. As a nurse, I just felt like I would always have that opportunity to take care of my parents whenever that day would come, because I had the skill set to do so. And just like that, it was gone. And so for me, hospice became a healing journey for myself. It kind of, while I was given to others, they were given to me without even knowing it, and it really helped my heart to heal from that loss, because in essence for me, it was everything that I didn't get to do for my dad. And so I love it. I love what I do.
There are a lot of people who feel that oncology is a depressing field because you're dealing with people who have life-threatening and potentially deadly illnesses. The thing about oncology is that it's exactly the opposite. It's incredibly life-affirming because people are facing a diagnosis that makes them reassess their lives and focus on the things that are important. And to be able to participate in that as a caregiver, it's a real privilege. And frankly, it's a gift that our patients give us every day.
A place like Penn Medicine depends on innovation. We're constantly at the forefront of what's new in medicine, whether it's new therapies, new medications, new ways of doing surgery, new ways of treating people.
Improving patient safety is arguably our most important obligation, and Penn has done an excellent job of advancing patient safety through unit-based leadership, where people who are on the ground interacting with the patients day in and day out identify what some of the risk elements are and what the solutions are.
We've really focused on the whole culture of how we work with patients.
In the last year, we've saved nearly an additional 1,000 lives through our patient safety efforts.
And that culture just pervades all the hallways here. The doctors feel it, the nurses feel it, the radiotherapy techs feel it, the people who are pushing the gurneys feel it. They know they're part of a winning team that is committed to great patient care.
The Blueprint for Quality is our foundational document. It's a strategic plan, but it's a lot more than that.
The Penn Medicine Blueprint for Quality and Patient Safety is a shared vision of all employees, not just the clinical employees.
We developed goals for the organization that we thought would be durable year after year after year. We would have the same goals. And they were to reduce mortality, to prevent people from dying, which is the ultimate goal of healthcare, and to prevent people from being readmitted to the hospital if they didn't need to be.
So it's this really big view of the world that we then take and boil down into smaller elements, each of which is designed to make us better and better at everything we do.
Essentially, the way our outcomes are going to keep getting better is through our caregivers and clinicians and staff at the front line.
This is not a top-down, management-driven program. Rather, it involves our unit-based clinical leadership teams, nurses, doctors, social workers, pharmacists, environmental services people, gathering together to look at how things are done currently and then making recommendations as to how they could be improved.
When we began the Penn Medicine Blueprint for Quality and Patient Safety, we established a bold, audacious goal. And that goal was to eradicate bloodstream infections from the Penn Medicine hospital system by January of 2010.
When an infection like that occurs, the patient will die about 25% of the time. So it's a terrible complication and one that we think is very preventable. So what we've accomplished is pretty impressive, I think. We have virtually eliminated bloodstream infections in the hospital.
We went 1,000 days of bloodstream infection free. So I think the goal on Silver 10 is to have every nurse trained and certified in taking out central lines to reduce the risk of bloodstream infections.
In a complex unit like that, where they do it day after day after day, it starts to sink in how many times they've done this perfectly. And when you think about that, managing this perfectly, doctors, nurses, pharmacists, technicians, it's really, really extraordinary, and it really, I think, motivates people.
1,000 days bloodstream infection free is fantastic, but, maybe that'll be history pretty soon, and then we'll move on to 2,000, and hopefully the whole institution can put this into their practice.
The Penn Medicine Blueprint for Quality and Patient Safety goes way beyond bloodstream infections.
It's not just providing excellent care or, practicing in a safe moment. It's actually providing that culture of excellence and safety whereby it's on your mind all the time.
The pharmacy department for Penn Medicine really wanted to have a unit-based clinical pharmacy program where you would have a pharmacist per each patient care unit. And part of that process, the goal was to have pharmacists doing medication reconciliation.
Making sure that the patient has the right medicine, right dose, and understands the reason why they're taking those medications.
Patients just don't want to, only access their providers by visit alone. So now it's how do we deliver care through visits? How do we deliver care through email? How do we deliver care through telephone? How do we deliver care when it's transitioning over multiple sites with multiple physicians?
So we want to minimize any preventable readmission or any unnecessary emergency room use.
Again, we're involving that frontline staff, the people who know the job best, to help us make the decisions and the workflow processes that meet their needs and still yield high outcomes.
So the key to this, and the only way it can be successful, is if the skill and wisdom of every worker can be brought to bear on the issue of continuous improvement toward a goal that no one gets hurt and gets the highest quality care.
Personal accountability runs pretty deep here.
I define accountability as what one does when no one's looking.
I see a lot of going above and beyond here at Penn Medicine. I see that not just people at the bedside, but people who work behind the scenes are just very helpful to everyone.
People who come to work here are high energy. They're not looking to be bored. They're looking to make a difference and to help people.
Whether it be the housekeeper, whether it be the CIO, whether it be myself as a project manager, everyone has a job to take care of the patient. Penn Medicine makes you want to do that. I mean, you have the support of Penn Medicine to be able to reach that extra mile for that patient.
Our ability to think about our patients as extensions of our family allows us to really personalize care and to think about this, sort of on an individualized basis.
I had been out on a long illness myself, and I had just gotten back. A lady called, and she was like, I could hear that she had been crying. And I said, what's wrong? And she told me, I just found that I had sarcoma, and she had it actually in the same place where I had it. This is Christmas time, and she said, and my family's we're so discouraged. She says, I didn't want to put up my Christmas decorations. I told her my story, that I was back at work and doing fine. She said, you were just in the right place for me at this time. She made her appointment, and she decorated her Christmas tree.
My colleagues are the best colleagues I've ever been associated with. I would trust them with my own life. I have trusted them with my family's life, and I will continue to do that.
If I didn't have people around me that felt that same way, I wouldn't be here.
I feel tremendously supported when I'm working, not only by the patients and families I'm taking care of, but my team.
Mentors and colleagues who are really at the top of their field.
Knowing that they're willing to invest in me, I'm willing to bring what I learn into Penn Medicine.
I think I was on orientation for 3 months. I learned a lot more in those 3 months than I did in nursing school.
It's not just about being good. It's about being the best of the best.
What we're striving for is perfect care in everything that we do.
Take a deep breath and just say yes to any opportunity that comes your way, because you won't get it anywhere else.
There's a spirit here and a culture that doesn't exist everywhere.
This is a great place to get care. This is a great place to be nurtured and to be supported. I can't think of a better institution to be at.